listening to the Pharmacy Podcast Network.
This is the Sex PharmD podcast with your host, Dr. Nadia Archambault, licensed clinical pharmacist and certified sex therapist. With a focus on women's sexual health and wellness, Dr. A is here to cover important health topics and answer all of your questions about subjects that can be applied to pharmacy practice. And now, here's Dr. A.
Okay, we're back today with my guest from the previous podcast episode I did. I wanted her on for part 2 here, Dr. Jenna Quinn. Welcome back. I'm very happy to have you here again.
Thank you. I'm very excited to chat. I feel like we could talk for hours.
Exactly. So just if you want to tell our listeners just a little bit about yourself again, if they didn't listen to the previous episode, just what you're doing right now with pharmacy and it's really cool stuff.
I am a pediatric pharmacist by trade. So I've been in a NICU, PICU, or ER setting, and always surrounded by, children. So it was always anyone from 0 days old, those little tiny preemies, to 21 years of age. And lately, some of the kids have been older in the facilities, because what I'm realizing is sometimes they have a hard time transitioning out of various facilities once they hit 21. But from being in the ICU settings and just around pediatrics, just exclusively in the hospitals, I realized that 2 patient populations were very much underserved when it comes to pharmacy and in that outpatient setting, in the ambulatory care setting. And so those 2 patient populations were our medically complex pediatric patients, and in addition, also our fetal maternal medicine patients. So we had resources inpatient for them as far as a clinical pharmacist. But then what I found was once they transitioned to outpatient, there was very few pharmacy experts on those 2 topics. And they're extremely high risk populations, both of them. So I built a business to cater to both those populations in various AmCare settings outside of the hospital where we're primarily used.
Yeah. And I just love this whole area of pharmacy that you've carved out for yourself. And of course, we'll give the info on how to get in touch with you and how to find you after in the show notes. But your Perfecting Peds, which is, the perfectingpeds.com website, you have also your company that you've created is pretty amazing.
Thank you. I called it Perfecting Peds off of my OCD. And I think everybody who is a pediatric or neonatal pharmacist has to have a little bit, because you have to be meticulous about all the dosing. But and through that, I just started taking care of a lot of moms in that newborn who were in the NICU or just on the well floor, or even the high risk ones that are, being watched by fetal maternal medicine. And so there was always lots of questions surrounding how safe X, Y, and Z medications are while pregnant, and then also while breastfeeding after they had the baby. So that's something that with my own personal journey, being on Effexor through pregnancy and breastfeeding, and really, quite frankly, needing that to survive, I can't imagine not knowing, the safety, efficacy, through my journey, because numerous providers told me to get off my meds, and had I not done what I do, I knew the risk, I knew the benefit. And for me, it was a no-brainer to stay on my meds. I think that's where we kind of get it gets blurry, but for a lot of people. But I think that with each patient, it's like, what are your risks if you go off this med? Like for me, it's like, I really can't function. And then what are the benefits if you stay on this med? And I think, there's so much guilt surrounding various medications while pregnant and breastfeeding, but you have to think of, if I'm not on these meds for anxiety, depression, or these antipsychotics, while pregnant and breastfeeding, I'm not going to be able to even function. Therefore, my baby's not safe. I'm not safe. So I think there's a lot more that goes into it than the surface level that a lot of providers think about. And they're just like, you have to get off. So it's
Right.
like a trigger, it's like they just see that someone's pregnant and then you think you have to be, all organic and off every single med. And so that's not necessarily safe for a lot of people.
Yeah. And I like to use the scenario with patients where you really have to be the best version of yourself. So to take care of others properly. And so, when you're on an airplane and they go through the emergency, and if the oxygen mask comes down, you have to put the oxygen mask on you first. And it's not being selfish. It's just before putting it on your kid, because then if you're not functioning, they're not going to be able to function properly. So it's that whole idea behind that.
Right. I completely agree, because growing up, my mom was like and obnoxious. She never needed a break from us. She never did self-care. She was just like always happy to be with us. And I was like, oh my God. And now having three girls, I just always stress to them, like, mommy needs 20 minutes to herself.
Right.
Or mommy's going to go, like, they already know what a spa is. Like, mommy's going to go get a facial. Like, never did any of that. Or mommy's going to go on a date with dad, or mommy's going to, like, they know my workouts are non-negotiable. You can work out with me, but I'm gonna do it, and you can just sit here and chill, or you can work out with me. But I think there needs to be, that needs to be a message that all women hear. Especially, we recently had a family emergency with my sister-in-law, and I think it's just not talked about enough that, like, you don't feel guilty for needing these things, especially if you're in crisis. Like
100%. So important. So so back to the breastfeeding, and I know that you're an expert on this, which is so cool. I love it. As far as medications that you can take while breastfeeding, postpartum, and the topic of contraception, because I've heard and talked to couples where they have the oopsie baby because they just, the woman just gave birth and then she wasn't taking anything. And her, the body hasn't healed 100% yet. So it can be dangerous also. So I wanted to get your take on the different types of contraception that women can take, and what you usually discuss with your patients who are breastfeeding and postpartum.
Yeah. This is very timely. So I have three girls. My first two were Clomid babies, and then the third one was an oopsie baby because we didn't think we could get pregnant. She's the biggest blessing ever. But now we're like, okay, three girls. We could not have four girls. We're like, okay, they're all going to be 2 years apart. They're all going to be like having their periods at the same time. I'm like,
no.
I like, me and my husband are like, we can't. So my husband goes, I called literally before Avery was born. That's my 6-month-old, to get him in. Of course, I called for a vasectomy. So we get the bill for his consult, and it's like over $400. And I'm like, Steve, isn't this covered by insurance? So I call his insurance carrier, and we're all under his insurance, right? Because I have my own business. So, and they're like, oh no, we're a Catholic institution.
Oh no.
So they're like, your husband's vasectomy is not covered, and either is any of your birth control. So, okay, cool. So it's timely because this has just happened last month. So during this whole process, I've been looking into, okay, so the vasectomy's quite frankly out of the question unless we want to pay like thousands and thousands of dollars, which at this point, that's cheaper than a kid. So we may eventually. I've had to literally like go through, okay, I am someone, I can't put hormones into my body anymore. Like I don't like I share with you that I'm on Effexor. I'm very anxious without my Effexor. But then also on top of it, like I realized very young, like, through the end of high school, that I did not do well on hormonal contraceptives with my mood, at least.
Okay.
And I always felt like I had like breakthrough bleeding. And so it took me a while. I eventually, Seasonique was like the magical thing that I was able to be on. But saying that now, like if I was to go back on Seasonique, that's not safe breastfeeding. So it's like, okay, what are my other options? Because I know in the past, with my first, I went immediately on the progesterone only pill.
Yes.
And that is completely safe. So it's talking about options. A lot of providers, that's kind of like their go-to, but there's a lot of other options that we don't really explore. But my last OB was awesome. And then in addition to my experience, so I'll definitely take you through all the options, but I feel like a lot of people go on the progesterone only pill when they're breastfeeding, because we know it's safe. It can't have any sort of estrogen in it. And so also to note that like a lot of women aren't aware that if you have any history of like a stroke, clot, any history, which is really important, of migraines, that's not really talked about.
I actually suffer from migraines, so I'm on progesterone only.
Oh, perfect. Okay.
Yeah, because the estrogen can contribute to that. And for years when I was younger, before pharmacy school, I never knew that was a contributor, the estrogen. And I was on estrogen birth control, had no idea.
Yeah. And that's a lot of my, like one of my girlfriends has like a Chiari malformation. And I'm like, you should really, please just go on progesterone only. Another one of my girlfriends, oddly enough, she had she was on estrogen birth control. She was a smoker, but it was like more like a casual, like, when you're young and dumb, and we're all doing stupid stuff in college and high school. And then, this was, before she even had any kids, she had a mini stroke. So then, so she was somebody that I was like, you have to get off that. Like, and then, God forbid you have like any sort of hypertension, like these are things, and she had migraines. So it's like the perfect storm of, but I don't think enough people know that if you have a migraine, you should absolutely not be on an estrogen containing birth control. Because sometimes they don't even tell, they don't even tell their OB that is that part of their history. That's
the thing. Yeah. Or history of breast cancer, family history of breast cancer.
Yes. Yeah. And my family all has extensive history of breast cancer too. Exactly. Yeah. So these are all things that like when you're at your OB, you're not like thinking of even telling them. But yeah, so that was like, so I started that after Peyton, and then that was my first, and I swear that's the reason, and I could be wrong, but that was definitely a contributing factor for me not like developing. I also went down on my Effexor a lot.
Okay.
With my first pregnancy, I don't know, again, talking about like feeling guilty about life. My last two, I was like, nope, I'm staying on this dose, and I'm not going to be like a hero. And they're both safe and they're both healthy. So, but like with my first, I had a lot of guilt surrounding it. And so they like, when I had her, after they started me on the progesterone only pill, which is really important that, I'm sure, taking it.
Take same time every day.
Right. It's like there's no forgiveness. Like with the estrogen tablets, you can even miss like a day or two and make up for it. But with the progesterone only, you have to take it within like that 30-minute period every day, or else you have an increased chance of becoming pregnant. So I think that too can be a deal breaker for a lot of people, because like it's hard, especially when you're a new mother too, to remember to like just take a shower, then let alone add.
Well, see, I tell them, set an alarm on your phone.
Yep. Set an alarm on your phone. Exactly. Yeah. So I think that heavily affected, it made my anxiety worse postpartum. So I think that too is like another thing that women should consider when exploring hormonal options postpartum, is in the past, how have you reacted to putting additional hormones in your body. And for me, I should have known. I just was kind of like blindly following the OB. It was my first pregnancy, first experience postpartum. And they said, like, you're breastfeeding, but we don't want you to get pregnant too soon again. So I started it. And then I didn't realize it was like a month or two of like kind of struggling, trying to figure out my mental health. And I was like, oh my God, I always have like the worst reaction. So I took that off, in addition to doing many other things, making sure a lot of women aren't well-versed that like your OB is your first step in postpartum mental health. If you're struggling, they have so many resources, and a lot of women are trying to find, go to their PCP or trying to get in with a psychiatrist, which is like almost impossible now. So using the OB as your first step, and the person who they do this all the time. And I think we forget that we kind of associate them with like, having the baby and delivering the baby and, your body postpartum, but think of them as they have unlimited resources for this. So that's obviously the first option, is those progesterone only pills. And I actually found an interesting website just looking through everything. It's called NURX. And what this is interesting. It goes through each progesterone. It has only progestin only or progesterone only pills. And it actually gives you different ways that you can purchase it. Even if you like at affordable out-of-pocket prices. So, for me, I think of me right now, right? So I have no insurance because of my husband working at a Catholic institution. Gotta love those Catholics. Someone, all my kids go to Catholic school. And I was like,
Catholic too.
Oh my God. I was like, oh.
I went to private Catholic high school.
Yeah, it's like, I should have known none of this was going to be covered. But it's NURX. And it was really cool by just going through it. It gives you all the progesterone, because there's a lot.
This is cool. I'm pulling it up right now. This is real. I'll definitely share this with the show notes. This is really, really great.
Isn't it cool?
Yeah.
And it tells you each one. And I went through individually for all of them just to like triple check they were all safe in pregnancy, or pregnancy. No, breastfeeding. And they are. And so the interesting thing, just like, even as for me, it was kind of interesting to look through all of them. A lot of them have specific times that they can be initiated postpartum. So for example, like a lot of the norephedrone, like in the website, they all have different names, but they're all
I know.
essentially the same thing. And they're all like female names. They're like Heather, Camila, like all, there was
I never thought of that, actually. I never put that together, that they're female.
They're all, and I'm like, what the heck? So someone was like having fun naming all of them. Essentially, they're all the same thing, looking them up. There was but on that website, they have a predominantly either norephedrone or I'm going to mispronounce this, droseparidone.
I know. That's a tough one too.
I'm going to butcher that, but either one of those are safe. And I actually like went in and like looked under. I love Lexicomp as my go-to for what's safe in pregnancy and breastfeeding. And they've actually gotten away from saying like 100% this is unsafe, this is safe. For pregnancy, for example, the old school, and we're going to age ourselves, is that it used to be categories like A through X. You remember?
Yes.
It's not that anymore.
Really? Okay.
Yeah, they completely revamped the website, and I love it. So what they do for a pregnancy is they tabulate like all the literature. So even case reports, like, so they'll give you, here's what happened in all these case reports. It doesn't, or all these studies, and it completely goes away from the A through X, which I love, which is kind of like what I'm advocating for, is it shouldn't be like black and white. Of course, you have those medications that are teratogenic. So of course you're going to change those over before. And also, not to have a squirrel moment, but my husband was on before. He'll love me for telling everybody that's on finasteride for hair
Yep.
growth. So
Mhm.
those are things that even your partner shouldn't be taking when you're trying. So like there are some absolute no-nos, but the cool thing is when you go into Lexi, it now will tell you like, here's every single study and here's what they found. And then for breastfeeding too, they know that they kind of summarize, it's called called an RID, relative infant dose. And what they found is that if the relative infant dose was less than 10%, for most drugs, that is considered safe. And
Okay.
so they'll give you the relative infant dose, and on top of that, they'll also populate anything that happened, you know, while it was studied. So for example, for norethindrone, they put in there that they took milk concentrations from various women.
Okay.
And just picking it up, and then it will tell you. I'm pulling it. I thought I saved it correctly, but no, that would be too good. But it tells you, okay, so it says information in the presence of norethindrone is available following postpartum administration of various women. And then what they did was using the breast milk concentrations, the relative infant dose of norethindrone is 4.1%. Compared to the weight adjusted maternal dose. So what they do is they say like what amount is getting to the infant, and
Wow.
it has to be less than 10%
Okay.
of that. And so
This is all on LexiComp.
Yes.
This is great. Okay.
It's awesome.
Yeah.
So breastfeeding is generally considered acceptable if the RID of the medication is less than 10%. And then it said there was like various plasma concentrations depending on, various milk concentrations. But it said that it even reports that it says isolated reports of decreased milk production, which is sometimes the concern of women. It was rare. They saw it in some cases, but it was extremely rare because that's a question a lot of women have. And then it says, when using this contraceptive, recommending breastfeeding is not, that the contraceptive is not initiated for 6 weeks after delivery, if fully breastfeeding, or 3 weeks after delivery, which for partially breastfeeding. And then it says, however, there are available guidelines that state norethindrone may be started at any time postpartum in breastfeeding patients. But I thought it was interesting because as we go through the various contraceptive options, there was a lot of like timelines to talk to your OB about. Like it said, start 6 weeks or start 3 weeks. So that's obviously something that even as a pharmacist, I didn't even think to even ask. But I mean, it makes sense because most of us, unless you're like, you had like the easiest delivery ever, you don't even want to touch your partner for 6 weeks anyway.
Well, that's part of the problem. So, you have a baby. What do they, now depending if you had C-section or vaginal, what do they usually say? Like, how long do you have to wait before having sex?
6 weeks for vaginal and 8 weeks for cesarean. And I'm assuming there's numerous reasons, but you really have to heal like everywhere.
And then after that time period's gone by, can they start initiating, let's say they wanted to go on progesterone, birth control, they can start that? Okay. Because that's important, I think, for us this is, again, territory that we haven't really explored a lot in pharmacy school. We got a little bit on it, but just how to talk to a woman who's just had a baby, counseling in like her sex life.
Yeah, my movie was like so awesome because I had told her I don't want babies. She's like, so let's talk about it. And we literally went through what we're going through, which is first the hormonal methods, and then the second, the non-hormonal. Like she covered everything. The other one too, like I said on that website, there was just one other one that, again, I could barely even pronounce. Drospirenone. It sounds like a fun cocktail. But it says, so just to read, because I like obviously to give everybody facts, but information related to the presence of drospirenone in breast milk is available following maternal administration of 4 milligrams daily. And then it's cool. They collect the milk and the average milk concentration, they tell you, and they say the relative infant dose of this was 1.5%, again, which is considered safe. Adverse events are not to be expected following infant exposure via the breast milk. And in general, again, what we're saying, progestin-only contraceptives may be initiated immediately postpartum if reasonably sure the patient is not pregnant. So this one says specifically immediately, if greater than 5 days since the menstrual cycle bleeding. Okay, we know that. This is basically saying you got to be careful and take it the same time every day.
No, absolutely.
The only other, so those are your pills. Honestly, like we're saying, the pills do have some drawbacks in the way that, you know, you really have to be on top of it. Like you're saying, set a reminder. Some other hormonal options are injections. So that depot,
Depo shot, Depo-Provera, I've seen,
So Depo-Provera is actually safe. So
okay.
If you have somebody that would prefer to do a shot that's going to last and they can come in every 3 months, you can do that. And that's
a good option if you just don't want to have to worry about taking a pill.
No, like who wants to do that? So it's, again, I can read what it says, but it says for medroxyprogesterone, it says the concentrations have been studied post that 150 milligram per ml injection. Administration usually occurs at that 6 to 7 weeks, as we're talking about. The maternal plasma were sampled over 12 weeks. And then it does say, like in most of the studies, that there is various plasma and breast, like actual amounts in their breast milk for each woman. But it says that the greatest concentration occurred within 2 weeks of the injection and then decreased over time. And then the interesting thing, because I know, again, women get really squeamish when it's you're introducing anything to their baby. It says that the metabolites were not detected in the urine of breastfed male infants following administration. And then in addition, urine concentrations of the LH hormones and the FS follicular stimulating hormones and unconjugated testosterone were no different in the breastfed male infants that were exposed to medroxyprogesterone versus those that aren't, which is obviously huge.
That is huge.
You worry about, especially if it's a boy. I don't even think about that because I'm like, have 3 girls. I'm not worried about messing with their testosterone. But no, in all seriousness, obviously, think about, is there any way I'm messing with this infant's hormones? And so adverse effects and behavioral effects were not noted. And then again, most of those women that were studied got it at that 6 to 7 week mark, which is perfect too, because you have a baby, you don't even go back to your OB for 6 weeks. So that at that OB visit really should be where we talk about these contraceptive methods. And then one other option is that hormonal implant. And so there is a subdermal, it's enonorgestrel, which is it's a subdural implant on the inner upper part of your arm. And then you actually can leave that up in there for 3 years. And that one specifically is a progestin only. And so that's an option for someone that's like in the phase that I'm at, where it's like, I don't want a baby anytime soon, probably never. And you can leave that small implant in there for up to 3 years. And then you can remove it and you can actually put a new one right in there. And for this one, again, this is safe in breastfeeding. It says that they took 42 breastfeeding women and they initiated treatment again at that 4 to 8 weeks postpartum in a 4-month study. The highest concentrations were out a month after insertion of the implant and decreased over time. The relative infant dose was 2.2% of weight-adjusted maternal dose. So it's considered safe. And the theoretical concerns of these implants that they could prevent the onset of or like lactation was found that was incorrect. It says that it does not affect the quality or quantity of your milk. So again, that concern that you could have decreased milk production is negated.
Okay.
And then breastfeeding infants of the mothers with the enogestrel implant were not found to have any differences in body length, head circumference, body weight, or any adverse or psychomotor development. So again, a completely safe option with that implant. Then so that kind of covers everything that's safe from a hormonal perspective. And then from which I wanted to do, again, was explore the non-hormonal options.
Yeah.
Because I do not like having hormones in my body. So the one that I found that I was really wanted to do, and I actually got a quote from the insurance company of what it would be just at value is, have you ever heard of the copper IUD?
I have heard of that. I don't know enough about it, but I have heard of it.
So it's called Paragard. It's an intrauterine copper contraceptive, and you go to your OB and they insert it into your uterus. So interestingly enough, sperm doesn't like copper. so it's like a completely non-hormonal way, and it will actually it's like immediately reversible too, which is really cool.
Great.
But it has no side effects, and it's completely no hormones, and it's completely safe while breastfeeding. So when I looked, I was like, oh my God, this is perfect for me because I don't want to put any hormones in my body. But I also I think what's really important too that I didn't touch on is efficacy. So for the hormonal implant or getting sterilized or this copper IUD, that is all over 99% effective. So if you're like,
even the copper one.
Yes.
That's amazing.
It's $900 if you don't have insurance, but I feel like if you're going to keep that baby in for 10 years, it's totally worth it. And then and immediately reversible too, right? Because we know, and I think I'm a child of this, like when you're on, like I said, I was on season E for like 10 years. When you get off of it, I really don't think we know enough, but I suspect that's why it took me forever to get pregnant with my first daughter, because I came off of it around my wedding, and then it took literally a full year to get. I mean, who knows? But just I think that's obviously something that we don't know enough about. Like
we don't. And then there's that opposite where they're saying, oh well, if you go off of it, you're super fertile. That like first month. Both. So I don't know. I know.
I've heard that too. And so, and it's been like as like a anecdotal that I've seen for me and my friends, it's all been different. So definitely can't draw any conclusions on that. But but then when you have the injection, we talk about the pill, and those options, they're 91 to 94% effective. And that's obviously if the user's using them right. For the pill. And then you have your non-hormonal options. Like I said, the copper IUD was the most appealing to me, but then this is probably more your jam than mine. But the 72 to 88% effective for these other non-hormonal options, which are the diaphragm. I'm like so unfamiliar with all these. That's pretty old school. I was reading that and like a sponge. I was like,
the sponge.
Oh my God, that seems extremely old school. So for the listeners that don't like know, because I was like, what the heck's a sponge? You can put it up vaginally, and it essentially sits there for 24 hours. You can leave it up in there for 24 hours, and then the efficacy is again 72 to 88%.
I think there was a Friends episode with that where Monica or someone was like hoarding, they discontinued it or something. There was some sitcom where they did that, and that was the first time I'd heard about it.
Oh my God, I was like, what?
No, those are old school. I always wonder about risk for like bacterial vaginosis
Me
and
too. That's what.
you
Yeah.
know, I
Yeah.
don't know. Yeah.
That seemed like the good old condom, which
Condoms. Yep.
at 34,
Yeah.
I went shopping for condoms. I felt like I was like, wow, this is so uncomfortable. And then in New Jersey, oh, gotta love New Jersey for so many reasons, but they stopped doing the plastic bags. So at 34, I
Oh
like always
no.
forget. So I'm like walking out with condoms in my hand. So that's great with like a cart full of 3 kids. People are like, probably like, what is this woman doing? Then you have your good
But
old,
you have to. This is another thing. Like you have to wonder, who came up with that whole idea and how insensitive it is. Are they thinking about that? Are they thinking about maybe someone, and it might deter someone from
oh my God,
buying,
I know.
any
Like
type
you
of
don't have the
condom or
bag.
anything
I
because
know.
they're embarrassed. So they have to think about this for consumers also.
Yeah, maybe do
Yeah.
like an Amazon drop instead of going to CVS with 3 children and doing that. I was like, wow, this is a first.
Oh man.
Then the good old pull and pray, as
Yeah,
my
I was
father
literally
says.
going to say that too. Pull and pray.
Spermicide, which
Yes.
you may be more familiar with than I am, but you have to put it on like X amount of time before.
Yeah,
Right?
and you have to put it on. And in fact, I was just listening to something about this with the spermicides. And if you have to make sure that you're putting it correctly, inserting it incorrectly.
It's like anywhere from like 15 minutes to 60 minutes before
Yeah.
sex, right?
So basically it maintains acidic vaginal pH. And that's really how it's working. They say at least 10 to 15 minutes before sex. But some are only effective for an hour.
Oh, is that where
You have to reapply every time you're having sex. There's a lot.
And obviously I'm not in this wheelhouse, but think if you're like in the dating land and you're like at that uncomfortable, like with me and my husband, and he's seen me vaginally birth 3 kids. So
Right.
I have to apply the spermicide, but like if you're in a dating world, that might get a little awkward.
It kind of takes the romance out of things.
Yeah.
Yeah.
And then the last thing is, which a lot of people are talking about lately, and I'd love, this is your expertise, but that natural cycle, that the app that people are using.
Yes. Mm-hmm.
It seems to be getting, so it's the first FDA approved birth control app. And so basically you take your temperature and then you kind of plot and trend your body temperature in according to your cycles. And I've heard a lot of women have success with this, and it's again 72 to 88% effective is what they're stating. But this to me is a little bit newer, and a lot of people swear by it.
Yeah, because they used to. So people used to just use a good old calendar. So on average, if you have a 28-day menstrual cycle, you're usually, ovulation occurs around like 14 days, they say, before the start of the next menstrual period. But then that length can vary depending on the person.
Mine always like grossly varied. I mean, obviously that's probably why for the first 2 I needed a little bit of help, but mine could be anywhere from like day 10 to day 24. I mean, it was like when I was doing those, when I was doing the ovulation sticks, like it was always like very inconsistent too. So.
And there's really only that they say like what, and you might know more because you've been through this journey there's like really 5 days where you can actually get pregnant.
Yep.
Yeah,
exactly. Yep.
Yeah.
And some people even say like optimally, like that 48-hour window is really like a magical window. And they say, to have sex at least once a day or every other day is usually enough in that 5-day window. And so, yeah, that's it. But apparently this app is awesome for tracking that, and then really narrowing down like based off of your temperature.
That's really cool.
Yeah. And that was something that I was instructed to do when I was trying to conceive, just with the ovulation sticks, was also to track my temperature too. And so some genius made this awesome app called Natural Cycles. So that's another
Yeah.
option too.
I mean, we can track our sleep now. We can track this, you know?
Oh my God, right?
Yeah.
Yeah, seriously. And so there are so many options. Again, I like just called that the Paragard to get like
Yeah.
some just background on how much it would cost with no insurance. But there definitely are so many options now that if hormonal or not hormonal and breastfeeding, you know have A to Z options on what you can take that's safe.
Yeah. Now on the copper insert, how is it once a year? How does that work?
No, just once, and it lives up there for up to 10 years. And
that's amazing.
Yeah, apparently copper it's like, again, like for some reason sperm do not like it.
I wish I had come up with that.
And it was like that's genius came up with that.
I know, that's really cool.
Yeah.
Yeah, and this new RX, this is great. You know, I'll put this in the show notes too. This is really just for some quick information too.
Yeah.
This is really good. Yeah, I mean, again, I feel like these are conversations that women may not feel as comfortable talking about because it's, they get squirmish when they're talking about sex, but it's important. And even more important, if they want to start using contraception, what are their options?
Right.
So,
right.
Yeah.
Right. Exactly.
Yeah. Thank you for sharing all that. That was a lot of really great information and your personal journey too. I appreciate you opening up to everybody. It makes it more relatable for everyone. You've been there with a lot of these things. So
yes.
Yeah.
No, we should all be open. There's, you never know who's going through something that for some reason or another people are, embarrassed to talk about them. Very
yeah, absolutely.
Because then you can relate to more people.
Mm-hmm. And as far as how to find you, we have your website.
Yes. So I have my website, which is just perfectingpeds.com. Some other ways we have a Facebook, a Instagram, and a LinkedIn, which is @perfectingpeds, and then my own personal LinkedIn and Facebook and Instagram, which is Jenna with one N, so Jena, and then last name Quinn, Quinn.
Perfect. And congrats on your publication. I saw that on LinkedIn.
Oh, thank you. Yeah.
That's really great.
My grandfather, I don't think I'll ever match him as a pharmacist, but he was insane. He had over 150 patents.
I didn't know that until I read that when you were talking about, that your grandfather was a pharmacist, correct?
Yeah. And he was a pharmacist, and then he went back and got his doctorate in chemistry. And so he worked at GlaxoSmithKline in Philly for, I don't know, like 30 or 40 years. And so he had over like 150 patents, and he wrote a lot of organic chemistry books, which was my least favorite subject in college.
That's amazing that he wrote books. That's so cool.
I know. And so, sometimes he passed away like 2 years ago, and he also discovered the association, was on the team of discovered that dopamine affects Parkinson's. And so he made huge strides in healthcare. And so, every time I have like a monumental, he's the reason when he passed a couple weeks later, it was probably a couple months, I bought my LLC, because I'm like, you know what, he if anything, he inspired me to do more and to do things like that are done, the non-traditional way. So I was just sad because he was like the only person that I would love to share my publication with. So
and for the listeners, the publication is Opportunities for Comprehensive Medication Management for Children with Special Healthcare Needs and Medical Complexity. I'm looking forward to it. Now, how can they find this publication?
So I think you can go on my LinkedIn. It's right there.
Okay.
And then that's like the preprints. And so it's going to be it got like accepted, so they put it into the preprints. But
Okay.
Then it's going to be on. Oh God!
And I love there's a photo too of you and your grandfather. Oh, it's just so sweet.
I don't think it's actually going to be published in a journal until January.
Okay, that's great though. That's so exciting.
But yeah, they'll do the preprints. And then actually I was talking to Todd from the Pharmacy Network. He wants to do a podcast just on that. And then
I think that'd be great.
I'm excited. We have a subsequent one coming out where we're going to actually unveil what we found to have like the first pediatric trained pharmacist in a long-term care facility that's exclusively for kids. So wow. I'm excited.
This is exciting stuff. I'm so looking forward to seeing what else you do. This is great.
Thank you
so much for coming on. And I know I'm going to have you on again.
We have fun together.
There's always more to talk about. But it was a pleasure having you on, and I'm sure our listeners found this very informative. I definitely did. So
thank you.
Thank you.
I appreciate it.